My name is Professor Topham Austin. I'm a consultant neonatologist. I look after sick and preterm infants on the neonatal intensive care unit. And while over the past 20 or 30 years there's been a dramatic increase in survival of sick newborn infants, a lot of them still go on to develop lifelong brain injury, placing an enormous burden on themselves, families, and on wider society. One of the real challenges is to be able to diagnose problems at an early stage in order to develop new therapeutic procedures. I've been heavily involved in developing new non-invasive imaging technologies, particularly in the field of biomedical optics. The beauty is that we can bring these instruments to the cot-side and we can measure changes in blood flow and oxygenation non-invasively and try and detect problems before they are manifest clinically. While imaging methods such as MRI have revolutionised our understanding of brain injury, it does require the infant to be taken down to a specialised scanner and does prohibit repeated or continuous monitoring of the baby. The advantage of real-time continuous imaging on the intensive care unit will enable us to see rapid fluctuations in brain perfusion in real time and enable clinicians to intervene and hopefully prevent any further damage from occurring. We have established an interdisciplinary group called NEOLAB, which is a unique collaboration between physicists, engineers and clinicians, enabling us to study patients within the hospital environment as well as develop new technologies which can be trialled at the cot-side. I'll now hand you over to Sam, who's the technical lead for this project.
I'm Dr. Samuel Powell. I'm a Royal Academy of Engineering Fellow and I work in the Department of Medical Physics at UCL. Diffuse optical tomography has a number of attractive qualities. For example, it's non-ionizing, it's non-invasive, and it's relatively inexpensive. However, systems to date have demonstrated limited spatial resolution. There's a large push in the research community to significantly increase the spatial resolution and sensitivity of the technique by improving or increasing the density of sources and detectors that are placed around the object that we want to image. So as we increase the number of optical sources and detectors that we are using in DOT, the amount of data that we generate increases significantly. This poses problems in terms of using this data in real time and makes it difficult to interpret images from the data that we collect. The aim of this project is to use new techniques, for example, compressed sensing, to enable us to use the vast amounts of data generated by these instruments in real time and thus enable real-time imaging. In addition, new techniques will inform the way that we design the instrument in order that we can collect less but more relevant data. UCL has played a pioneering role in the development of diffuse optical tomography, and the successful student will have access to the latest next generation instrumentation through collaboration with a spin-out from this department.